Hi, I'm Dr. Kavipriya Soma, GP with special interest in women's health. Today's topic would be pelvic pain in women. What are the possible causes of pelvic pain? We have to remember pelvic pain have got multiple sources of pain, but it can be physiological, as in a normal process, what happens in your body can occasionally become painful, or pathological. So there can actually be a problem and that is indicated to you in the form of pain. The second classification that it can be offered is acute or chronic. So acute is sudden onset that comes up. It may last for anywhere between few seconds to a few minutes to a couple of hours and disappears. Chronic is anything beyond 6 weeks. So any pain that lasts beyond 6 weeks is classified as chronic pelvic pain. Now, please remember, pelvis doesn't mean just that there is female reproductive organs, but there are also other organs like the bladder, the bowel, and muscles and tendons. So all of them can give you grief, but they can be in the pelvic region, so it would be labeled as pelvic pain. Now, you also need to remember pelvic pain may occur in a pregnant or a non-pregnant state. So the causes can be different in these two situations. Now, as mentioned, pain not only, even though it may be in the pelvis, it may not only be by the organs in the pelvis, but it can be central nervous system sensitization that can also cause pelvic pain. So let's start with what is acute pelvic pain. Like mentioned before, acute is something that comes as a sudden onset, lasts for a short or brief period of time, and generally responds to conservative measures of just observation or simple pain relief. So if we were to focus on the female reproductive organs, some of the acute causes of pelvic pain would be ovulation pain, or dysmenorrhea, that is pain during menstrual cycles. Like mentioned before, acute pelvic pain, there can be other causes such as bladder bowel. So if there is a bladder infection or a bowel infection, that can also be reflected as pelvic pain. Or musculoskeletal problems in the pelvis can also be reflected as pelvic pain. So the simple measures that you can do is observe, see what your physiological functions are, and if they are not related to that, or if the pain is not going away after doing conservative management like observation, simple pain relief, whatever you're not allergic to, please seek appropriate help. Of course, if the pain is sudden, intense, it is something that you cannot control, you need to go to the emergency. Let's focus on the pain that is produced by the reproductive organs. So, ovaries, tubes, uterus, cervix, and vagina. What are the physiological processes that can cause pain? So, ovaries, simple ovulation can cause pain. So, generally, that pain can be mid-cycle, localized to the pelvis, and occasionally that can cause irritation of the rectum. With the tubes, physiologically, generally, it should not cause any trouble. Uterus, so menstruation. So during the physiological process of the menstrual cycle where the bleeding happens, because of the blood that gets collected within the womb cavity and the womb cavity tries to expel it, cramping may happen. So that is a physiological process. What are the pathological processes that can cause trouble? Simple things like infection. So infection can happen to the tubes, ovaries, within the womb cavity or uterus, cervix or vagina. It can be bacterial infections. It can be infections due to sexually transmitted infections or post-operative infections. So they are the other causes. Obviously, the pain will last longer. It may not respond to your general simple treatments such as paracetamol or NSAIDs. And of course, it may be associated with fever, bloating, tenderness in that area. So please seek appropriate help in those situations. Continuing with the causes of pelvic pain, the most important one is endometriosis. So endometriosis can happen in any part of the pelvis. Importantly, in the ovaries, then there can be endometriotic deposits like you can see in this model on the tubes. So that indirectly can lead to adhesions from the bowel that can cause pelvic pain. The muscle, uterine muscle, can have these are the endometriotic deposits within the uterine muscle, which can cause pelvic pain. It may also thicken the uterine muscle wall. So that is the term. The term that we use for that is called adenomyosis. Endometriosis can happen in cervix as well as vagina, external. Pretty much any part of the body it can be affected. But generally, it is one of the predominant leading causes of pelvic pain. Now, these are non-pregnant states. Now, during pregnancy, the initial implantation, when it happens, some women may experience cramps or pains. Sometimes that can lead on to miscarriage if it is an abnormal pregnancy. So pain can be present in those situations. If the pregnancy is implanted in the wrong spot, so it is called as ectopic pregnancy. So if it's in the tube, ovary, in an abnormal location within the uterine cavity, so more lower, or in the cervix, then they are all abnormal spots which can lead to pain during pregnancy. If this is something that you experience, please seek advice from your health professional. If you would like more information or if you would like to visit our website, please visit www.athenawomensclinic.com.au, and you can also tell us if there's any other topics that you'd like to discuss.